Hi, this is Jen Rubin for The Contrarian. I am delighted to have with me Dr. Jorge Benjamin, who is the head of one of the nation's most important public health organizations. Dr. Benjamin, thank you for being with us.
I'm glad to be here.
Tell us a little bit about the career that you've had in public health for decades and a little bit about the organization for which you're now the executive director.
Well, the Army paid my way to medical school. And so I, of course, joined the Army right out of medical school and did a residency in internal medicine, fell in love with emergency medicine, actually. Spent really the first half of my clinical career practicing emergency medicine. My last duty station was at Walter Reed Army Medical Center in DC. And then I got out and went to the city hospital for about 2.5 years. My phone rings and the mayor says, "Have I got a job for you?" So I ended up being the city health commissioner in DC. Then, new mayor, new job, went out and practiced emergency medicine for a brief period of time. Mayor calls me back and says, "Hey, we need you to come back." I actually was a kind of a deputy fire chief. I was an EMS director in DC for about 10 months. And then eventually left and went to Maryland, first for 4 years as a deputy health secretary for the health department, and then 4 years as its secretary. Maryland is one of these big departments, mega department, has everything you can think of in health, including the Medicaid program, all the health insurance programs, and all the traditional public health programs. And then again, new governor, new job, and ended up coming to APHA, which is going to be a short stint, maybe about a couple of years. So I figured out what I wanted to do when I grew up, and I'm in my 23rd year.
And the initials stand for the Association of...
APHA, American Public Health Association, is the professional society of people interested in public health. We've been around since 1872.
Wow.
And in fact, at one point, we were the Public Health Association for the Americas.
Wow.
Mexico, Canada, the Caribbean, everything. Now they all have their own national association, so it's just the U.S.
Well, I think we've come to the right source to talk about public health. RFK Jr. had the first of really 2 hearings he's going to have to confirm for HHS secretary. What was your initial thought, and what are the concerns as a public health official you would have if someone with his beliefs became the head of HHS?
Obviously, we thought that anybody that is going to be the Secretary of Health ought to have, I personally believe they ought to have training in medicine, nursing, or health, or one of the health fields, health administration, et cetera. And of course, he doesn't. He has a degree in environmental law, but that's not broad enough for this job. He also, doesn't have the judgment. He's made a lot of anti-science statements. He cherry picks information. To lead the nation on health and be the chief health strategist, you have to develop trust. And we don't trust him. And I don't think very few people trust him. And then management skills. He was a board director of a very small organization, which is designed for really functionally as an anti-vaccine organization. And they may, at their peak, had a $25 million budget. We're asking him to run almost a $2 trillion agency with 80,000 employees. And he's never managed anything complex or complicated like that. So lack of training, poor judgment, and lack of management skills are the 3 things that we've been against. And quite frankly, the hearing, he demonstrated that he does cherry pick information, that he really doesn't understand the material. He has no understanding of healthcare financing, even the basis of what Medicare and Medicaid, the Affordable Care Act do. And he demonstrated that quite clearly in his answers to the questions when he wasn't being evasive.
Right. I'll put you down as a no then on the confirmation. Talk to us a little bit about, and I think we got a taste of it this week when NIH, the National Institutes of Health, were told to stop communication. Tell us what role the federal government plays in just health information, health updates, critical information for doctors, hospitals, researchers. Give us a sense of the importance of that whole complex of research organization centers for American medicine.
Yeah, the Department of Health and Human Services, especially our federal government, are supposed to be um, and have the capacity to bring around the world's experts, and then put that information together and then give it back to us in a coherent manner so that we can make informed decisions. They do regulate stuff as well to try to harmonize things across the nation. Um, but if you talk specifically about the National Institute of Health, it's the largest entity of promoting research in the world. It has some of the best scientists in the world there. It funds a great deal of the academic research. It's the one place where um, scientists can do early research that can stimulate the private sector. So it serves as an incubator for an amazing amount of new ideas. And then the private sector takes those ideas and can monetize them, scale them up, and really put them to work into society. When you tell an entity like that, first of all, that it can't put the grants out, it literally stops new research. But what happened this time is also in many ways impeded ongoing research because a lot of the conversations that are going on, a lot of the projects and project directors that have to be involved with these research enterprises all around the country need to give them further guidance, need to help them get additional funds, need to coordinate activities. And if you've got a study, a rat study going on, and all of a sudden something comes along and interrupts it, that totally disrupts your study. That's why people get up at 3 o'clock in the morning to change reagents and clean rat cages and take blood and do tests, because that stuff doesn't stop just during the daylight Monday through Friday.
Right.
And they've done it and then the communications part on CDC, Center for Disease Control and Prevention. Right now we're in the middle of a major outbreak of H5N1, which is an influenza virus that primarily impacts birds, but is now impacting dairy cattle in particular. And they can't put the information out that's up to date, so we can't track the outbreak.
Wow. Let me ask a more specific question. The administration has declared war on what they call DEI, and I'm not even sure they know exactly what that means. But in fact, medicine is not generic. Medical issues and medical treatments affect women different than men, older people different than younger people, certain ethnic groups more than others. How important is it that we be able to make sure that our medical care focuses on all affected people and that we don't take the mistaken view that medicine is just medicine that covers everybody the same?
We all bring different genetic makeup to the table. We all bring a different life experience to the table. We all bring different environmental exposures to the table. When you put all that stuff together, we have to target our interventions based on that combination of experiences if we want to get everyone to optimal health.
Right.
And so that means we have to look at diversity based on race, ethnicity, gender, different life experiences, different income levels, because again, all of those things, 80% of what happens that makes you healthy occurs outside the doctor's office. So we have to be able to look at all of those factors. And diversity, equity, and inclusion does not limit anybody. It's not an exclusive concept. In fact, I talk a lot about Appalachia and rural America and some of the disparities that they have. There are two counties, for example, in Putnam and Mason County in West Virginia, which have a 2-year life expectancy between those two counties.
Mm.
And by the way, West Virginia is 97% white. This is not based on race in terms of difference in races. This is fundamentally white counties that have big differences in the resources in each county, which is ultimately resulting in different life expectancies. And when you see this, it makes you understand that you have to then look at your data and then focus it. So diversity, equity, and inclusion programs are designed for us to look at the differences and craft solutions to bring everybody up and not pull everybody down.
I think that's extremely helpful perspective. Let me end on this talking a little bit about Medicaid. You mentioned that RFK Jr. seemed to think that there's some kind of contribution or deductible or something like this for Medicaid patients. Tell us a little bit about what Medicaid covers. People think of it as just for the poor, but it's more than that. And also the necessity of maintaining a robust Medicaid system. There are a few states out there that have not undergone the so-called expansion of Medicaid. So there's a whole group of people who are not receiving kind of basic medical coverage and hence don't seek medical treatment. Talk to us a little bit about some of the basics about Medicaid, because I think after listening to that hearing, Americans might be confused as to actually how it operates and who it helps.
Well, let me define on this. So if you're 65 years of age and older in our country, you are able to participate in our basically single payer universal health care plan called Medicare. But anyone under the age of 65, therefore, gets their health insurance coverage either through their employer or they buy it in the open market if they can afford it. But for anyone who can't afford it, in every state except the 10 that didn't expand Medicaid, I'll come back to that in a moment, Medicaid is kind of the safety net insurance program to allow them to get insurance through private plans, I might add, through the public sector, to the private sector, actually. Same insurance plans you get if you have a job and are buying Blue Cross, Blue Shield, Aetna, et cetera. But it does have an income level. So people at a certain income level and below, because it's a safety net program for people who can't afford the higher cost insurance plans. And they don't pay premiums in this program. It is managed as a joint project between the feds and the states. The federal government participates by contributing so much, and then the state contributes so much. And it's managed by each state. Each state has their own Medicaid program. Now, there are 10 states, and by the way, this was expanded under the Affordable Care Act. There are 10 states who have decided that they did not want to expand it. They have Medicaid programs, but the level of eligibility is so low, it's almost laughable. In some cases, it does cover low-income women and children, but in most cases, it doesn't cover other single adults. And therein lies the rub, because it turns out that those states that have not expanded Medicaid are the ones, when you rank states in terms of healthcare outcomes, they tend to be at the bottom. So Louisiana, Georgia, Texas, Florida are examples of states that haven't expanded Medicaid. And the challenge is, Mr. Kennedy gave people the perspective that the plans that is not useful. It turns out that lots of studies have been done to show that Medicaid dramatically improves people's health. The presence of it improves people's health. And when you compare states that expanded Medicaid coverage versus those that did not, the ones that expanded Medicaid coverage have better health outcomes than the ones that did not. So it is the insurance program of last resort in some communities, but it's also really a mainstay now. Now, other important thing to know about two things about Medicaid. Number one, that almost 40% of all births are covered in the country, regardless of race or ethnicity, are covered under the Medicaid program. And that is, it is the larger payer for long-term care in the country. And in fact, it is the backbone of nursing home care in this country. It pays for. In fact, that's where most of the money goes. So it is a very important staple of our health safety net. And Mr. Kinney, of course, did not understand that at all.
And just one additional element, my understanding is that it also plays a very important role in fighting addiction and in the opioid abuse problem, which would affect many states that are, frankly, primarily white in the Rust Belt and other areas that have been terribly afflicted by opioid abuse.
That's correct. Obviously, if you're covered, it has a great benefit package in most cases. So it does deal with all the behavioral health issues, mental health issues, substance misuse issues, addiction of other drugs, and I think the more interesting thing about it is that it is also keeping a lot of our rural hospitals afloat.
Right.
And it's a real challenge. And you do hear complaints. You hear complaints about how much providers are paid. As one example, that's the biggest complaint. We don't pay our providers enough. But it turns out that the states can control provider payment rates, so those can be fixed. It's not like it's something being managed at the national governor level. It's being managed at the state level. So states can actually address their provider participation issues. And Mr. Kennedy talked about the fact that there are providers that don't want to participate in Medicaid, but states can fix that by just paying them more. And I actually can tell you that I actually experienced that as a state health secretary, where we were trying to get different kinds of providers in our program, and we just paid them more, and they participated more.
Well, Dr. Benjamin, you've been extremely helpful. I fear that when citizens tune in and they try to learn what's going on from some of these nominees, they wind up less informed than they were to begin with. And it is very important that people understand just the basics of these programs and who they help. And I hope you'll come back in the future. We need good public health information for people. And you make the final point, which we are very much aware of here at the Contrarian, which is state and local officials are critical. These people have much more to do with your everyday life than sometimes is reflected in the news coverage. State, local officials are absolutely critical, and particularly in the healthcare arena. So thank you for being with us, and we hope you come back in the future.
Absolutely happy to do this.